Hello, how's things? You're very welcome to the MSD Animal Health podcast series. My name's Jack O'Connor, I'm the Ruminant Marketing Manager. This is a first for us, going into the area of podcasts, but I guess the purpose of our podcast, we're going to different disease areas with different experts in their field, and I'm delighted to say I'm joined by Mary O'Connor, vet with MSD Animal Health. Mary, very welcome.
Thank you very much, Jack. I'm delighted to be here.
And also to my right, we have Dr. Owen Ryan from UCD. So, Owen, you're very welcome too. And thanks for coming out to us to have a chat on Udder Health. So, Mary, over to you.
Today, we want to talk about all things Udder Health, but probably mainly focusing on cell check, milk recordings, and how to use milk recordings and really investigate the data and be able to pull out what's important and what's relevant. So, Owen, I suppose start off, maybe will you just give us a bit of background about your own line of work and what you do in UCD and what the service that UCD can provide?
So I work as a lecturer in UCD in the farm animal department, and a lot of my work is through the hospital there, but also there's the herd health team, and so we would carry out a lot of farm investigations there as part of a referral service around the country, and that would encompass mastitis investigations, fertility, nutrition, calf health, and various other things as well. So that takes up the majority of the time.
And with regards, I know that you're on the technical working group with the Animal Health Ireland for Cell Check, Owen, and you've put great amounts of work into that, as all the members on that group have. And there has been massive advances made in milk quality and controlling cell count down through the years. This year, Cell Check have launched a new TASA funded programme, which I think is excellent, because before, I suppose, we were probably focusing on the herds that mightn't have had an issue and that they could go towards selective, whereas now we have an option for herds that just need to get things under control slightly and then go towards selective. So could you just talk through that new scheme?
Absolutely, Mary. And as you say, up to now we had a dry cow consult, which was very much for herds which had a low cell count, a bulk tank under 100,000 all year round. So it was brought to our attention, that we did need to have something for the herds under pressure. So this is the lactation consult now, as opposed to dry cow consult that's been developed through Cell Check, and it's based around a multidisciplinary team approach. So where the farmer would be surrounded basically by a team of professionals. You've got your vet, your milk machine technician, the milk processor, the co-op advisor, everybody who would have knowledge and expertise, who can give that farmer guidance and help with a mastitis problem, be it a high cell count problem, or be it a mastitis problem, or be it a mix of the two. And particularly given the importance of that and the dealing with high cell count in the new environment where selective dry cow treatment and everything has been brought in following legislative changes.
And I think that's probably one of the most progressive things out of that report, is that now it's looking at everyone needs to be involved, and it's no longer one person coming in trying to possibly fire brigade the situation. Just from doing the training, I would have known to ask the questions around vacuum and pulsation and liner changes, but if you handed me the report, I wouldn't have had a clue.
Oh, absolutely. The knowledge in that have, is fantastic,
it is.
And everyone is an expert in their own field, and that's really important to understand.
Exactly. Isn't it? Yeah. So I found, that I think that's a really essential part to that consult. And just with regards, if I was a farmer coming to you and had a bulk of maybe hovering 300 to 400 and just struggling to get things down, and what time frame would I be looking at to reduce that down to, say, below 200 on to something more manageable?
So it does depend to a degree, but on average, let's say in general, if this sort of a consult would involve an initial meeting, an initial discussion, ideally, if there was milk records there, an assessment of milk records, and if there wasn't, you'd have a little bit of time, maybe hopefully to get some milk records, and then an actual investigation, actual on-farm investigation, looking at routine, etc. And following on from that, if it was a contagious problem, and milking machine was very important in it, and some aspects of milking routine were very important, the biggest thing that you can see in terms of speed of improvement would be an improvement in the recent infection rate. So decreased spread of infection on the farm. So between your investigation and drying off, you might see a reduction in the spread. Now the overall cell count will maybe only drop maybe not by a huge amount, but it won't continue to rise, which is often the major problem, is that it'll continue to rise all year round. So you'll keep it steady and hopefully drop it a little bit. But then it will need a dry cow period for to get, the source dealt with. So you've got this whole 2-arm approach, dealing with spread and mastitis on one side, but then also dealing with the source. And the source really is all around dry cow management, be it dry cow therapy and or culling, and those two are very important. So typically then to get the response from that, you're talking about 6 months later to a year later where you see huge improvements.
Great.
But you should hopefully see an initial drop in cell count, or at least stasis, not getting worse, and then after a dry cow period, a significant drop and good control. And the best way to see if it's been controlled in is via your milk recording data. You do need data to see if you're under control.
Brilliant. So with regards milk recordings then and data, say, for a herd, and you mentioned there if they weren't milk recording, you'd probably have to wait and get, some milk recordings after your first initial visit. How historical do you have to be with those milk recordings, and how many would you be looking back on when you're doing the investigation?
You can, it's a good point, Mary. You can actually make ground even just from one.
Great.
Do you know? So like if a farmer has never been milk recording before, that's not a problem. And if a farmer is still reluctant to milk record, some ground can still be made, because you can see if there's various activities that could be improved or maybe machine issues. But if a milk recording can be done, and between that and drying off, you could have maybe 3 milk recordings in total. That gives you very, very good information, particularly from which to identify problem cows and make decisions on cows.
Brilliant.
So that would be the ideal. Difficult enough to do an awful lot on one milk recording, but it does still identify and help identify problem cows which can be targeted.
Okay. And if I'm going back then and I'm switching over now and I'm the vet in practice and I'm going out, even if I'm not involved in the TASE investigation, but I'm, have 6 cows in the crush and the farmer's getting, really worried about this, and there is a contagious issue on the farm. And if he wants me to look at milk recordings, and he has 3 to 4 milk recordings, what's the first page that I should pull out and have a look at, or the first part of it that I should analyse?
I think the cell check report itself actually is a good place to start, because on that first page it gives a very, very nice graph there showing the cell count distribution, both the recording, if there is milk recording, and bulk tank across. Now you'll only have it if there is a history of milk recording on that farm. But if there is, the cell check report is excellent. And below that initial graph, which shows what has been going on like for a 12-month period or more, then you get 2 more lovely graphs which show recent infection rate and persistent infection rate in the herd. And those 2 are really, really important sources of data. The recent infection rate will tell you if there is an ongoing spread of infection in the herd, and that's critical. And that's how cell count is spreading. That's how bacteria are spreading, be it in the parlour or elsewhere. And that's really, really important. And then the persistent infection rate, often particularly if it's a contagious problem, will point to a source and indicate, how severe that is. On the second page, then there's some very good data as well on that. And probably the most useful bit is on dry cow cure rate. And dry cow cure rate is really important, and that'll just give you some indication of perhaps, how useful previous therapy went, but also if there was a lot of new infections going on, and also if you're dealing with bacterial infections, which are quite difficult to manage.
So the recent infection rate really kind of does show us what's going on, what type of problem we have. The type of problem then, contagious or environmental. What type of trend would you see if you were looking at, say, it's environmental and we can control this really quickly? Yeah,
that's a great point. Like, as part of these things, we do tend to try and concentrate on looking for trends or patterns. And with the recent infection rate, with an environmental one, you would expect to see a rise in cell count, a pattern of a rise in cell count associated with the housing period. And that can sometimes be quite obvious, and sometimes it can be a little bit hidden too, because what has been on the rise has been mixed infections in this country over the last number of years, whereas traditionally in let's say 10 years ago, the vast majority of it, for example, cell count problems were very much contagious. Now there is a little bit of a mix involved there with bacteria like strep uberis, where you can have a rise certainly in the housing area, which does suggest environmental involvement, but then it will continue as a high cell count issue during the year too, because it can become co-adapted and spread.
And Owen, is that kind of coming back to the issue we're having at farm level around space? Space per cow or cubicle per cow even?
Absolutely, Jack. Absolutely. One of the major probably reasons why some herds have had issues and have had difficulty, I suppose, in controlling mastitis problems, both environmental and contagious, has been expansion over the last number of years. And expansion has put significant pressure on housing, put significant pressure on labour, and significant pressure even on the size of milking powers and everything. And with expansion then, and say if in the housing there's a lack of cubicle spaces, there's a lack of space in the calving areas, etc., there's a huge challenge and a huge risk of environmental infections and new infections over the dry period in particular.
As a whole, there's a greater pressure on that whole farming system and that production system, not only for animals but for the farmers as well and labourers as well.
Absolutely.
Just coming back to Mary, you were talking about milk recording. So I guess the real point there is, if a farmer's not milk recording, now is the time to go talk and try at least get one done. So if there was critical milk recordings that they should get done the calendar year, which ones are they? And what time periods are they?
That's a good point. Probably the most critical one between now and drying off is one before drying off, and it's recommended that should be done within a month of drying off, and that is a really important one for decision making at that time. And 1 month, maybe out to 6 weeks from drying off would be a good time. Other than that, then it's really good to get a milk recording done relatively early in lactation. I think that does show you, it'll give you an idea of how a dry period went in terms of dry cow cure rates, and also it'll give you an indication of, if there are problem cows earlier in the season that maybe could be managed, that will stop a problem getting out of control later in the year. So that will be February, March, maybe into April, depending on calving pattern on the farm.
Owen, we know that there are big changes coming in terms of legislation and our approach to mastitis control and dry cow therapy. And selective dry cow therapy has been embraced in some ways on farms. It's definitely moving in the right direction towards that. What are your thoughts on how to go about it? Like, milk recording really is an essential part of that puzzle. You wouldn't advise anyone to do it off the bat of not having proper records. Yeah. So what are your thoughts on how things are moving in Ireland and how we're moving towards selective dry cow therapy?
So I think selective dry cow therapy at the minute it's presenting a little bit of a challenge. The big challenge is that to really decide on what cows to select for antimicrobial treatment versus what cows get just a teat sealer. That is really an individual animal decision. So you need individual animal information. And unfortunately, there's about only 40 to 50% of herds milk recording at the minute. And for those herds then that are not milk recording, there's a significant challenge. And for the vets who are going to have to prescribe at the end of the year, how do you make that decision? So between now and then, I suppose our major recommendations, we would encourage farmers to try and consider and gear up for this milk recording in that last 6 weeks before drying off. I think that'd be brilliant. That'd be the ideal, the optimal way to do it. And by doing that, that actually will help identify cows. And in some herds that have had a high cell count, it'll only be a very, very small number of cows that might be suitable at all for selective. In other herds that have milk recording, then there can be quite a large proportion of cows who could be teat sealer only. The alternative, of course, is California mastitis testing, and that is quite labour intensive. There's no doubt it can be effective. Like, there's recent research from New Zealand, even this year, Scott McDowell 2022, and that in Journal of Dairy Science, and that showed that using California mastitis testing, you can get even slightly better bacteriological cures, than with cell count. However, you use more antimicrobials. It can be done. It's quite labor intensive. So there are your two options. So if milk recording is not going to be done, farmers and vets need to be aware that California mastitis testing will also need to be done. So there's two options there.
So you've outlined there just on the important times of year. So first one after the dry period, which would be within 60 days.
Absolutely.
And you get a lot of cows in that time frame. And then 30 days before the dry period, where you can make your decisions and make, really, I suppose, informed decisions around your dry cow management. Just with regards contagious patterns then and contagious trends on milk recordings, on a recent infection rate, if I'm standing on a farm and I'm looking at that sheet, what would I be seeing on if there was a contagious issue on that farm?
Generally, with recent infection rate, your target is to have it less than 7% at any one time. And typically with a contagious problem, what you'll find is that it'll be higher than that, and higher than that typically all through lactation. And I think that is the major pattern with contagious, that it carries out all through lactation. And in our grass-based system, there's no great pattern of a drop when they go to grass. And that suggests then that it's not associated with either housing or grass. It's more associated with something common. And the common factor then is they're going through a milking parlour every day through lactation. So that is really what the pattern suggests. That's
brilliant. That's a really, really concise way of looking at how the contagious issue on Irish dairy farms is such a big issue.
And there's a practical solution to that too. You can actually look at your milk. It's not finger in the air. It could potentially be a simple fix. Absolutely. With correct hygiene or cleaning or changing that practice in particular. So
that's absolutely right, Jack. And there could be significant issues maybe in a milking machine that could easily be sorted by a milking machine technician coming and doing a service and doing corrections on particular things, which can make fairly significant and fairly quick progress.
Absolutely.
And I think that's a really important point to make, Jack, and Owen as well, because I find cell count, if I was dairy farming, I think it's one of the most stressful things. And looking at a cell count being high, it's very hard in the mind, and it's very difficult. Then you can get into a rut, and maybe you don't want to talk about it, and maybe you don't want to deal with it, and you kind of the ostrich effect a little bit.
You're nearly hoping it solves itself.
Exactly.
Just asking a question, as you were saying, don't get the correct people in, be it a vet, milk advisor, milk and parlour technician. Could be a simple change to fix the problem.
That's right. I think because everything there's achievable goals in every aspect of farming, and it's very attainable.
Absolutely.
To start making changes and to go in the right direction.
Exactly. And it does need that at least one occasion where you go on to the farm and you do go into that parlour and you see how things are, and maybe you take your samples, and then you maybe look at housing if that's the time of year where that would be an issue too.
And sometimes as well you need another pair of eyes.
100%. And as you said, small simple changes, sometimes just tweaking things, and you can make a huge difference, So
that's right.
There's options there, and I think we have more options now than ever. It's just to get in and ask the questions. Now we're going to move over towards a slightly different aspect of milk recording and how to analyse data and how to pull the data out of it. And it's the nutritional aspect of it. So looking at our trends in butter, fat and protein throughout the year, and the different times a year that things can, I suppose, when a vet is going out onto a farm doing a clinical examination, that it is useful to have a look at the records. And I suppose this is where, if we can log into ICBF and have a look before we land out into farm, it's even better again. But Owen, could you just talk to me a little bit about, the fresh period there where, if fat is shooting up in the tank and individual cows are coming back, way too high, say a black and white, big tall black and white, she's giving you between 4.5 and 5 in fat, and she's kind of nearly melting herself. What would you be advising now in that situation, or what's that signifying?
Well, high fats in the recently calf period, or the post-parentorial period as I call it, usually indicates negative energy balance, and you could have a lot of cows at that time in actual ketosis, or at least subclinical ketosis, if you see that. So it depends on whether you're looking at it via the herd level data, which you can get on the milk recording, or via the individual animal. So that there's actually a number of different reports there, and a number of actual different profiles too on the ICBF milk recording data, which you can actually download to help analyse that. Even the actual non-milk recording herds can actually get a co-op performance report off, which even will give at least a monthly average for fat and protein, and even you can see a pattern on that. And we go back to patterns and trends again, which are really good to see. So if you see a pattern of a very high fat and also a very low protein, that usually is a very strong indicator of negative energy balance and or ketosis in a herd. And to some degree then you have to take into account on the farm the type of cow and the actual breeds of cow. You would have different targets depending on the type of herd that's in there. For example, with protein, milk protein is most influenced by energy in a diet, because protein is produced via glucose, gluconeogenesis in the cow. So if there's a lack of energy, protein will tend to drop. In a typical Holstein Friesian type herd, at a herd level, you would like to see protein of 3.2 or above. And once it drops below 3.2 for a period of time, that's a fairly strong indicator at a herd level that there's probably an energy balance issue going on. All these trends are much easier to see, of course, in a tight calving compact system, such as a spring calving type system. Whereas if you have a mix autumn and spring, they can be hidden a little bit. Now, if you have individual milk recording, then on ICBF there's ICBF profiles, and in the milk recording test profiles you can download those there, and you can look at cows and sort cows via days in milk, and you can look and see what are air lactation cows doing, and that's typically the cow that you're most worried about, as you pointed out there. And at that level, the individual cow, if milk protein is dropping below 3.04 in more than 15% of cows, that is a strong indicator of negative energy balance. Fat to protein ratios, then that's another thing you can look at, and fat to protein ratios is something that's very useful too in a crossbred herd, or at least where there's a component of the herd crossbred, because protein will be typically quite high where you have a lot of crossbred cows in. So looking at low protein really isn't that sensitive. Whereas fat to protein, the ratio between the two is actually good. And if you have a high fat and a low protein, where it reaches that 1.4 ratio, 1.4 or more, that's a relatively good indicator again of an energy balance problem. So fat divided by protein of 1.4 or more is a energy balance issue.
And these are all great things as well to look back on retrospectively, even if spring is over and you do want to do a consult with your farmer, or the farmer vice versa wants to just ask the vet, the fat protein ratio is a great one to look back on over the spring period or that early lactation period, be it what type of system they have, and look at what that ratio is, and you'll know straight away whether there's a feeding issue there or not. That's right. And if cows are coming under pressure at certain points of the system. That's
right, Mary, and it's extremely important, and it's an important thing to pick up on, and even something that a farmer could be watching as well on, the texts that they get from the co-op on a weekly basis. Really a good thing to check what the protein and the ratio between the two, because of the knock-on effects of energy balance there. It can be sometimes even associated with outbreaks of clinical mastitis, like E. coli mastitis or strep purpura mastitis, if it's very air lactation cows that are suffering a problem. But the biggest impact, of course, will be 6 to 8 weeks down the line on fertility. And if you can identify and hopefully correct an issue of negative energy balance in March and April, that'll make sure fertility will be better in May and June. However, if energy balance issue will persist through March and into April, that'll hit maybe the first 3 to 6 weeks of the breeding season, which is critical. Just critical, isn't it? Mm-hmm. Critical, yeah. So it's a very important thing, and it shows the extra advantages of data and milk recording and all those things. You're not just monitoring cell count, but you're monitoring fertility, nutrition. And then at different times of the year on, I suppose I'm kind of honing in now, maybe late May, early June, when you're going into your later rotations of grass, it's a little bit more lush. Mm-hmm. Bull tanks are possibly taking a hit from year on year if you compare them, and butterfat falls off. Mm-hmm. Your protein is staying up, they're out on grass, so they're off silage, they're out full time. What does that tell us about the status of the cows?
at that stage?
Well, if the energy is staying up and the fat is dropping, then that fat at that stage, fat is most commonly affected at that stage by either the fibre component of the diet, or by the type of fatty acids in the grass. So you have two sort of things which cause what's sometimes referred to as low milk fat syndrome. And if it's associated with the fibre, that can often then lead to a problem of too much acid production in the rumen, sometimes referred to as subacute rumen acidosis. That might also be seen in a herd where cows might be a little bit loose in the dung, might not be fully eating in the grass, a little bit back in yield as well, not quite right, and the farmer would pick up on that, there's no doubt about it. And the other side then is you can get a herd which seems to be performing well and cows seem very healthy, but fat has dropped. And of course, fat is very important when it comes to the check at the end of the month. In those herds, typically again it is that month of May that you identified. Quite a lot of herds in the country are affected, and it's changes in the likes of linoleic acid and acids like that in the grass at that time, which affect rumen function as such, leading to a drop in milk fat. That's grass type. It's not something that's that easy to sort. It does tend to peak in May, that problem with the grass, and usually by June, July on it sort of has sorted itself out. But that one usually occurs without health effects on the cows, whereas the subacute acidosis, usually you'll see extra health effects plus or minus a drop in yield in the herd at that time.
So I suppose moving on from that, if I was a vet attending a farm like this, it's useful to be able to pull the records and definitely look, like, instead of just doing your basic clinical examination with a thermometer and stethoscope and a rectal, that you'd be able to look at the data and see, oh look, here the yield is down, the butterfat has dropped off. It'll give you a good indicator of what's going on. Absolutely.
And again, at that time, we're right at the start of the breeding season, aren't we? We're into it there. And if you get subacute rumen acidosis at that time, that will affect fertility. It'll affect conception rates. It definitely will. It's certainly something to monitor. And at the same time, we'll be looking at the protein as well. But typically speaking, usually energy balance wouldn't be as common an issue at that time of the year.
Now, Owen, we have spoken there about on the nutritional aspects of milk recording and what we can pull from that in the fresh period, and also there around the kind of coming into breeding season, summer months. Just looking then towards the dry period, and how do we tackle that from the point of view of, I suppose, body condition scoring and grouping our cows. We know that from what we've spoken about already with, cell check and selective, and the types of dry cow therapy we're going to be using, whether or not cows will need a longer dry period, number one, whether they can, possibly handle a shorter dry period. We'll certainly have to monitor nutrition closely if we are chopping and changing the dry period like that in herds. What is your way of handling that? What times a year should we be body condition scoring coming up to that period, and when can we make changes that are in time and that it won't be too late to cause, I suppose, issues in the fresh period?
I think body condition scoring in the last month before drying off is a great thing to do. It gives you an idea of where the herd is. Generally speaking, most herds will be fairly consistent across body condition. The vast majority of cows, at least 85 or 90% of them, will lie within the same category. But you might always have about 5 or 10% of cows that could be outside of that, and they're the cows really that you'd like to pick up on, whether they're under conditioned or maybe due to issues maybe with lameness during the year or some problem like that, or whether they're over conditioned, maybe they were carryover cows because of previous fertility issues, or maybe due to their genetics they just tend to get a little bit heavy and lower in yield as the year goes on. Those cows then they certainly are a challenge to manage over the dry period. Now you can look at it in various different ways. One option is grouping according to body condition. That very much depends on the availability of housing. And that goes back to the point that you made earlier on, Jack, about about that. Space is a critical issue, and not every farmer can have that option and can use that option of grouping, picking out those 10% of cows maybe that are thin, which could be fed more, or the 5% of cows that might be already heavy that might need to be fed less. And unfortunately, with our system, we can't really leave cows outdoors. Out wintering is not an option much as such, so they have to come inside as such. So it does put pressure on it. If the ideal scenario is the ability to group and then to feed accordingly, and you'd be talking about drying a body condition score before drying off, and then a month after drying off. So in the middle of that dry period there, I suppose we're talking about a classic 2-month dry period as being the ideal in most cases. That will also be dependent too for some cows on their fertility performance, how late they're going to calve the following year, and those are the cows that are probably at greatest risk of getting fat, getting heavy.
Perfect. Yeah. I suppose I always look at the dry period as like the runway for the fresh period, and it's where things can be right or wrong, whether you're going to have a good spring or a bad spring nearly.
You're right.
And it's
100% right there.
It can be tricky to get it right, but it's so important to definitely have a look at the cows and do that bit of body condition scoring. Just with regards length of dry period, Owen, and in terms of going back to a contagious issue on farms, I suppose without sounding too colloquial about things, but Staph aureus is a huge issue, and we know that it can do so much damage to the udder, and it thrives in hiding from the immune system and then rearing its head every now and then, and you can see the spikes on the graphs, and they go up and down with the staph infection.
Yeah.
We know that the dry period is an area where they can be cured, or we can try and find a cure rate for these cows. What length of time do you need proper involution of the mammary tissue and really let them soak up and have a rest? How long minimum?
The minimum is 8 weeks, really.
Yeah.
Like you certainly need 2 weeks to be allowed for just involution.
Yeah.
And if you have 2 weeks on the other side of the dry period for colostrogenesis, the production of colostrum and bagging up basically, that will leave then a 4-week period in the middle, during which time the cow's own immune system can help self-cure almost, or cure any intramammary infections. The problem there is if you have a very short dry period of say 4 weeks, then you have no time in the middle. So the risk or the chances of cure is very, very low. So 8 weeks is the preferred. If you went to 10, 12 weeks, from the point of view of curing of mastitis infections, it's certainly not a bad thing. But there's no great advantage to certainly going over 10 weeks, and you have that risk of a cow getting heavy.
And that's a very important point, particularly this year, because some farmers might consider to milk on.
Yeah.
But the impact on the following lactation, if the cow doesn't get the correct duration of the dry period, could actually impinge then on the following year. You might get a quick short-term win for an extra 2 weeks, but for the following season, there could be significant issues.
Absolutely, yeah. So if you have a cow with a very, very short dry period, to be honest, and if that cow has any history of mastitis or high cell count, you're actually totally dependent on intramammary antibiotics to try and get a cure.
And just out of interest, Owen, could you describe what Staph aureus actually does in the udder to a cow, just so that we can get a kind of, I suppose, visualization of how much damage it can do? I always describe it as a bunch of grapes, but if you have a better analogy.
Yeah, it's a really frustrating infection, Staph aureus. So it does a number of things. Within the milk itself, it has this ability to form a slime around itself, and they group together and form this slime called a biofilm, which means that intramammary antibiotics and immune cells in the milk can find it very hard to get rid of it. Then it can actually survive within cells, and even survive within the immune cells. It's so resistant, and it can actually invade into the tissue of the gland, the actual tissue of the gland, and then set up abscesses. So large areas of pus surrounded by fibrous tissue, and multiple abscesses. Sometimes these abscesses can be so big they'll burst out through the skin in severe cases. In other cases you won't see them there, but there'll be small abscesses bursting fairly frequently. And that goes back into that trend that you described, Mary, of these rises in cell count periodically as maybe another abscess ruptures during lactation. But over time, with all that chronic inflammation, then it can cause individual quarters to go quite hard over time. And also, more importantly even than that, it causes a significant reduction in yield. With each passing lactation, with all time of all the inflammation going on, you get a significant reduction in actual yield. Generally it's been sort of shown quite strongly that for every 100,000 cell count rise above 200,000, yield drops by about 2.5%. And some cows that are chronic cell count cows will be yielding over the lifetime of their lifetime, maybe 20% less than what they could have done if they're there for 2-3 years.
That's a lovely synopsis of just how important it is to really, have a look and see what's going on, isn't it? That's a really important point to make.
Absolutely. The losses associated with high cell count are actually sometimes quite hidden or indirect, and then culling is a big loss. The risk of culling is a big loss as well to farmers, and that doesn't take into account fines and various things if cell count goes very, very high too.
Yeah. And we've spoken there, I suppose, about the longer dry period and those contagious infections really do need that longer dry period. Some cows in the herd, I suppose, they can handle a shorter dry period, and we need, we can facilitate that, but we do need to manage that too correctly with proper nutrition and having a look at what's going on. But I suppose culture and sensitivity will really show us what's going on within the herd. So if you were to give advice, to vets and farmers own, what would you be saying is the minimum to do in terms of culturing milk and seeing what's going on a farm?
So my advice anyway, from the point of view of say a cell count issue, would be that prior to drying off, there should be samples taken from cows that have had a history of high cell count, or certainly when you're taking samples on the day these cows are California mastitis test positive in either 1 or 2 quarters. Ideally, you need to have a number of samples taken really to get a good picture of what's going on in the herd. Maybe 12 samples even from a herd from which maybe half of them might be first lactation cows. That will give you a very good idea of what are the major bacteria on the farm and the bacteria causing the problem. It'll identify whether it's contagious or an environmental problem for you as well. Now, if the rise in cell count or clinical mastitis is occurring early in lactation, that's when sampling should take place as well, and sampling of clinical mastitis cases even throughout a lactation is a very good thing to recommend, and if farmers are doing that, and if they can manage to do it in a sterile manner and maybe freeze samples and then over time when they have a number get them sent away, it's a very, very good thing just to know what's going on. And these days, the labs will provide very good information from the point of view of antimicrobial susceptibility testing as well, so that you can actually identify and target appropriate treatments too, both maybe during lactation if it's appropriate, and certainly very importantly at drying off.
That's they're really, really important, to have that collective overview of the lactation. I think it's a really valid point to make. And just with regards then, if you're seeing a really mixed bag of infection coming back, or, if you're seeing CNS on a lot of the results coming back, what's your advice in the kind of immediate term there to is it just to tidy up on how you take the milk samples, or what would you be saying?
Yeah, I suppose if you take a number of milk samples and the report, say from the lab, says that you've got contamination through maybe a third of them, and maybe a third of them grow nothing, that's not that uncommon for someone not to grow anything. But if you're getting very few samples which you would consider would be significant and would fit with a pattern of contagious mastitis, that you'll be hoping that you'll be expecting to come across either Staph aureus, Strep uberis, maybe Quaggas negative staph, and some of those other types which would be relatively common. If you're coming across unusual results, then you would question whether samples are being taken in a sterile manner. The advice that I think we would give is that as part of investigation, any of the people there that we mentioned, the vet, even the co-op processors, those people can give help take samples in a sterile manner, and the data you get back is going to be as good as the data you send in. And if you can send in good milk samples, good quality milk samples to the lab will send back good quality results, which then you'll get your value for your money then.
You mentioned there 50% of the samples should be from your first calvers. What's the importance of that, and why would you say that as opposed to taking it from, you know, a whole herd and a randomized selection? But you always mention focusing on 50% of samples from the first calvers.
So the first calvers really, they give you a strong guide of what's going on currently in the herd, because they've only really been in this milking parlour, and they've only been in this herd for a short period of time. So whatever infections they've picked up have occurred during this lactation. So you can be guaranteed that it's currently ongoing. This is the current problem. Whereas if you were to sample quite a lot of old cows, some of their infections they may have and may have carried over from historical issues in the farm, which might no longer be present. You know, they might maybe have some strep uberus problems from maybe 2 years back, but subsequently the housing and the calving area is well sorted. Whereas the heifers might be culturing back with Staph aureus, and that now is the problem. You know, so it is important just to make sure you don't miss or confuse the issue by just sampling old cows, which could be holding chronic infections from a historical problem which might no longer be present.
Owen and Mary, there's been an awful lot of really good factual information, and nearly, I wouldn't say too much, but if we were to almost summarise on the importance of the milk recording from another health point of view, but also a nutritional point of view, could you even summarise that into 2 or 3 points for people to take action with from listening to this?
Well, I suppose when it comes to other health, be it SMAG cell count issues or be it clinical mastitis issues, it's very, very difficult to make progress without knowing individual cow data. And milk recording gives you that individual cow data, which can help you then inform decision making. And decision making is in terms of what you do around drying off and what you do during lactation. Whether individual cows would be more suitable for drying off a quarter, whether it might be suitable for treatments, or whether at drying off individual cows, given their history, might be cows that you could put on a culling list. One of the major reasons why sources of contagious bacterial infections have built up on some herds over the last number of years has been expansion, and as part of that, maybe a failure to cull cows that maybe should have been culled due to chronic mastitis problems, and some of that has been due to the fact that there was a lack of information to show that was there. The other thing with the data is that you can monitor and see if interventions that have been taken on a farm following an assessment of the milk machine and the routine and everything have made an improvement, maybe through your recent infection rates, etc. So you can monitor and see, have you made improvements? You can help make decisions. When it comes to nutrition, then that's a critical period of time in the springtime, where if you can pick up on particularly energy balance issues, it can inform fertility performance later in the year and improve that, and it certainly can minimize postparturient uterine infections and various things like that. So it can have significant effects and can save a lot of money on farms.
I think as well, we often talk about maximising the system, and nearly sometimes maximising your system can put too much pressure on it.
Yeah.
And it's nearly going back to optimise your system. So, cull your cows, improve your infrastructure to optimise your farming system to make it more productive, which in return is more profitable. If you're maximising things the whole time and not maybe keeping up with services or routine cleaning or whatever the case may be, eventually it's going to creak at the seams and issues will start arising. So
you're dead right, Jack. And there's a whole even other aspect to milk recording that we even haven't discussed, and that's the whole genetic side and all that, which is crucial.
That's another podcast on.
So there's so much information there.
It's vast. Yeah. I just find it fascinating how we can get so much information about one cow from one little sample.
That's right. That's right.
If I was even to ask you on, I said it to Mary there before we even started, if you went on a scale of ugly, bad, okay, good, great, perfect, where would you kind of feel we are as an Irish industry, Irish dairy industry, around the area of udder health?
I think we're good. Because 60% of herds have mastitis, well controlled.
Yeah.
Cell count less than 200,000 cells per mil pretty much all year round. little enough clinical mastitis problems. There's no doubt that there's still a cohort of herds which need help and which can improve, but the majority of herds are doing quite well. Quite well, and you'd have to say like that Irish dairy farmers and Irish farmers in general are good, and they're up there with the best around.
Yeah. And if there's anything else to take from this, is that we've identified there is people there to help. There's courses there to help. There's not a stick to beat you, it's to help the farmer and their farming system as well. So
and the vet in practice, because
Absolutely.
It's essential to be able to pull out the data and log into ICBF and look at a farm comfortably and have a good assessment and overall assessment. And I think that it's a great thing to be able to do. So it provides a massive service.
Absolutely, and I can see going forward like vets, the more and more involved in mastitis control, and I think everything is driving that. Even all the new legislation, it is driving all that. Yeah.
From the perspective of a vet in practice, and you're dealing with a farm that historically has always had a low cell count, so we'll give it a 60 to 80, always bulk hovering around that. We'll get the odd clinical case of mastitis. They embraced selective dry cow therapy. They went 70 to 80%. Their cut-off rate was 80,000 for individual cows. They followed the cell check guidelines. It's 2 to 3 years in. They're happy with it. There's been no major issues or anything like that. But now their bulk is just pushing up towards 100, maybe 110, comes down to 90, goes back up to 100, and it's just irritating them because they've always had a lower cell count than that. What can I say when I'm standing on the farm to that farmer to encourage him to stay at what he's doing, number one? Or do I need to take action? Is there something going wrong? Should I be worried?
Well, that type of a rise isn't uncommon. It isn't uncommon. The important thing, I suppose, to make the farmer aware is that that is a relatively small rise in cell count, and from the point of view of milk quality, it won't have a big impact. From the point of view of risk of mastitis, again, it's a small risk. There will be contributing to that some new intramammary infections, and so what in those herds that's most important to consider, in addition to teat sealing, is environmental management. And some of those infections can occur in that last couple of weeks before calving and a couple of weeks after calving. So transition cow management, those two areas there can be very, very important when it comes to reducing the risk of new intramammary infections in those herds. But a rise to 100,000, while frustrating, certainly won't necessarily mean that the herd is likely then to suffer a massive rise in cell count in the next lactation. But what would be always best would that there would be ongoing milk carding monitoring of individual cows, just in case some cows have picked up an infection, maybe strep uberis, which can become cow adapted and can become chronic or persistent during the next lactation, so that they can be picked up, and over the next year then decisions can be made in terms of treatment and down the line whether culling might have to be an option for individual cows.
So from a whirlwind discussion there all around udder health and milk recording, to summarise, we're hoping that this will equip vets and farmers to be able to gather more data, number one, and use the data, number two. We really feel that from this we've extracted so much information from you, Owen, that we're now probably more confident in what we are able to talk about comfortably on farms. And I think that's a huge part of our job day to day, to be comfortable talking about this, because the data is there and it's just needing to be used, really. So with that, having said that, I suppose myself and Jack, just on behalf of us and MSD, we'd like to really thank you, Owen, for taking part in this. You're a fountain of knowledge. We like to chip away at every now and then and get the nuggets of information.
Well, I'd just like to say, like, there's a lot of help now available to vets and to farmers, and to, as an industry, there's a lot more people working together, and I think this AHI lactation consult is an example of that, and I think we should all hopefully work together to the betterment of the farmer and to the cows under our care.
So with that, we can close this one. Thanks very much for listening. Tune in again to the next part of this series, all focused on udder health.